The time is 7:52 p.m. local time on the 14th of February 2026. It's -1 degree outside and I'm lying in a bed in the Bucharest endometriosis hospital. So today feels like it's been a long day and I'm getting a bit fed up with just lying down, I suppose. But I know this is part of healing. And I've had quite a lot of sleeps today. I still feel a little bit out of sorts. Still feeling a bit out of it. Yeah, dizzy. Breakfast was interesting, and I had the same for lunch, which is warm diluting juice as a soup. So in a bowl. Was it's very interesting. It was quite uncomfortable to sit up and eat. The bed is obviously one of those that you can kind of mechanically rise up, which is really helpful. It does take a lot on my stomach muscles to obviously lean forward, and there's so many things that you use your abdominal muscles for that you don't really realize. So I'm being super careful. Dinner was a little bit more eventful. It was a soup again, but it was more of a vegetable soup kind of thing. There was one or two, or something like that, a piece of potato or something to chew, so it was quite nice to chew something. So I wanted to tell you a little bit about the surgery experience, I suppose. Sorry, my mouth gets really dry. So the surgery experience. So before I went into surgery, I feel like I left a few things out, and I'm sorry about that. It was kind of intense. So when I was being prepped, after I had the enema, I got to have a shower, which was very nice. And then one of the nurses put on some compression socks on me. When the time came, another nurse came and got me and walked me to the elevator. We took the elevator to the floor of the surgery, and when I came in, I laid down on a bed, and a woman came in and presented herself as the anesthesiologist. She was absolutely lovely, and she asked how I was feeling, and I said I'm very nervous. And she didn't say don't be, which is not helpful. She said, I understand that. One of the surgeons came into the room and started explaining to me exactly what it is that they were planning to do. I can't say that I remember everything that he said. He was very thorough and detailed in what he was telling me. And even though I might not remember everything that he said, it was really mindful. He was really mindful and very... it was distracting from the prep going on around me, which was nice. So it was just the two of us in the three of us in the room. And then he finished, and as he was leaving, another surgeon came in, and he was saying that they just wanted to discuss whether or not to keep my cervix, because they were obviously taking out my womb, and they wanted to know how I felt about it. And I couldn't, I was just so nervous. I just couldn't even think about what my cervix was at that point. But he was very helpful when I asked what does he think. And as this was going on, she took the most massive needle out. And I just looked in horror at her, and she must have seen my face. And he obviously saw my face. And I just looked at her and I was like, no. And she said, yeah, I'm really sorry. I really need to. But she was so gentle, like really gentle. And the doctor, he said, okay, I'm just gonna stand here and we're gonna distract you a bit from this. So he basically said that he would recommend keeping it because there could be complications with taking it out. There can always be complications leaving in as well, but why take something out if you don't need to? And which I really agree with, absolutely. So he was so nice. He just stood there and spoke until she was done, and he could see that I was a bit more comfortable. And he thanked me for the chat, and then he left. And she showed me into the theatre. So she showed me into the theatre. It was a bit daunting. It's weird. I've never been in surgery before, so it feels like you're walking into a film set. It was so ridiculously clean, and there was not many stuff in there. Basically just the bare minimum that they will be needing. And she told the anesthesiologist walked me in, and she said, you're gonna have to take your gown off yourself. Now this is something that Mandy already told me, prepared me for. I'm the kind of person I'd like to know what's gonna happen, because then I can mentally prepare myself. And as a woman who's been through sexual trauma, I really appreciated knowing so much that this was something that was going to happen, because I always pictured that I would be laying down and they put me to sleep and then they take it off. But yeah, so I took it off and I handed it to one of the nurses, and she actually had a bag that I had to put it in, so she didn't touch it. She was wearing gloves. So they were very conscious about infection risks. I also had my wedding rings on when they were going to put in the set in the IV in the for the anesthesiologist, so I had to put them in some gloves for someone, so they didn't touch them either. They were very, very thorough. So I gave them that, and it felt a bit strange. There was people walking about, and I was completely naked. except from these compression socks. so, um, so I went up. They showed me exactly where to go and lay down, and I had to put my legs in a certain place. And I could feel the anesthesiologist stroking my arm a little bit, which was really nice. And I felt really nervous, and you feel extremely vulnerable. But looking around, I mean, no one was looking at me. No one looked uncomfortable with me. I didn't feel uncomfortable because they were there to do a job. They weren't there to look at me naked at the end of the day. So, yeah, it was a weird experience. And I can remember looking around in the room, especially looking down at my toes, and hearing the anesthesiologist asking me, "Are you starting to feel tired?" Because I was blinking quite slowly. I was very aware of that, and I said, "Yeah, a bit." And then I don't remember anything. Before I woke up, I can remember having a dream, but it could also be something that I might remember from waking up earlier than what I can remember waking up. I don't remember what it was, but I wish I remember what it was. But somehow that thought brings me to Callum, so I think it was a memory or something in my mind that made me think of him. And yeah, so here I am now. It was an interesting experience that I've never experienced before, and I can not compare it to anything else, but I was such a good experience when it came to the professionals who were taking care of me. The care has been amazing so far. So this afternoon, Callum visited, which was so nice. It was so nice to see him. I felt really bad because I kept falling asleep and I kept waking up to him talking. He was told that he could sleep there if he wanted to, but he said he wanted me to get the rest and enjoy having a room to myself, which I do really appreciate. I would have loved to have him there, but at the same time, to be fair, he needs the rest as well for when I get back and he's gonna have to take care of me. It'll be intense for him, so it's nice for him to be able to enjoy Bucharest. He's told me, sent some photos. He went for a wee adventure, so I'm so happy for him. And obviously sending me photos of cakes and stuff, which is so nice. And while Callum was visiting, Dimitri, one of the surgeons that I met, just before the surgery, he came in and told me everything that they did. And that all went well and they got everything and they were very happy with how it went. And in the end, they didn't have to do a bowel resection. There was a part of the intestine that had a nodule, so kind of like a hardened bit on it. So instead of completely resect and take it apart, they managed to scoop it out and then put some stitches in. So I still have to be super careful, but it's so much better for recovery than the bowel resection. So I'm so glad that happened, and they've sent that away for tests along with my womb, and I got to keep my ovaries and my cervix, and there was deep infiltrating endometriosis in places, and the womb was quite hardened because of the adenomyosis as well, which had really weaved its way in there, and that would have caused obviously a lot of pain. And the nodule as well on my bowel would have, that's been what's been causing me pain when going for a poo. I've had a lot of pain, and also I've had a lot of pain and problems being able to pass, and also I've had pains out with that throughout the day. Sometimes when I'm sitting, sometimes, yeah, and I don't feel that anymore, which is amazing. And Callum did tell me that the other girl who had surgery, I mean, I don't know what she had done, but she was out walking in the corridor, and I felt a bit bad. I felt like he was saying that I should be, but he assured me that obviously he understands that everyone has different recovery times, since we don't know what she had done. But the surgeon, Dimitri, said as well that how recovery is going for you now is up to you. You will need to push yourself a bit, and in a safe way. And again, such care, such empathy for what I've been through. It was really nice. It was amazing. And he told me that the catheter was going to be taken out. The drainage is still there. It's a bit uncomfortable. I would have liked that to be out. And he did say that they need me to go for a pee. They need me to say that I've gone for a pee and how it's been, and if there's any blood and stuff. So I am very happy to report that they took it out. It was actually Dimitri that took it out, and it wasn't painful coming out. I was mostly kind of tensing up because I was expecting it to be, but it wasn't painful, and I did manage to go for a pee, which was amazing. Obviously not right away, but it was a little bit stingy, not too bad, and there was no blood, or tiniest bit of blood, but that's obviously normal. With the drip being in, it's a bit annoying because I keep going to the toilet every 5 minutes, and I'm drinking as well, so but yeah, so it's all been positive, and I really feel I need to have a sleep now because I'm quite tired. So yeah, good first day. Love, Naomi.